small wounds can become seriously infected, in some cases lead to amputation. But here's the good news.
Hi everyone, and welcome to another episode of Inside Interventional Radiology. In today's episode, Dr. Chandran Nadarajan, consultant clinical and interventional radiologist, discusses an important topic: how interventional radiology plays a role in managing diabetic foot ulcers. Let's tune in to hear from Dr. Chandran Nadarajan.
Hi everyone, I'm Dr. Chandran Nadarajan, a clinical and interventional radiologist. And today I want to share something that could make a real difference for people living with diabetes, especially those struggling with foot ulcers.
Dr. Chandran, what happens in foot ulcers among patients with diabetes?
Did you know that diabetes doesn't just affect blood sugar? It can also affect your blood flow, especially to your legs and your feet. And when circulation is poor and the nerves are damaged, a condition we call neuropathy, wounds on the feet may not heal properly, and over time, these small wounds can become seriously infected, in some cases, lead to amputation. But here's the good news: these complications are treatable, and there is a minimally invasive way to do it. It is called angioplasty.
Dr. Chandran, what is interventional radiology?
Think of interventional radiology as an image guided medicine. Instead of using a large incision or traditional surgery, we use tiny instruments and advanced imaging like X rays, ultrasound to treat conditions from inside the body safely and precisely.
Dr. Chandran, how angioplasty helps heal foot ulcers?
Let's talk about how angioplasty works for diabetic foot ulcers. First, we insert a small tube, we call catheter, into the blood vessels, usually through a tiny puncture in the groin. And using real-time imaging, we guide it to the blocked artery in your leg. Then we inflate, basically open up a tiny balloon to open up the blockage and improve the blood flow. Sometimes we place a stent, which is a small mesh tube, to keep the arteries open. The whole procedure usually takes about an hour, and it can be done under local anesthesia. And most patients go home either on the same day or day after.
Dr. Chandran, why angioplasty matters?
Angioplasty boosts blood flow, so your body can naturally heal from those stubborn foot wounds. Yeah, angioplasty also helps to reduce leg pains and discomfort, especially those who are having it while walking or sleeping. Yeah, on rest. Yeah, and it lowers the risk of severe infection and, of course, the risk of amputation. It's a minimally invasive procedure with a very quick recovery time.
Dr. Chandran, who should consider angioplasty?
If you or someone you love has foot wound that just don't heal, or pain or cramping in the legs, especially while walking, or some of them even have it while resting, or your leg feel cold, pale, discolored, this could be a sign of blocked arteries, known as peripheral arterial disease. Don't wait. A simple ultrasound or sometimes angiogram can help to diagnose the condition. And we can see if angioplasty is the right solution for you.
Dr. Chandran, message for those dealing with diabetic foot ulcers?
Diabetic foot ulcer should never be ignored. With early detection and modern treatment like angioplasty, we can restore blood flow and help wounds to heal and prevent serious complications, including the need for amputation. So, if you're dealing with a non healing wound or you are worried about a loved one who might be, talk to your doctor. Interventional radiology might be just the game changer you need. Thank you so much for tuning in. Stay healthy, stay informed, and take care of your feet.